NDTV 24/7.
Well, it's that one activity or the one thing that all of us do all our lives, right, from birth to death. So we breathe about 10,000 liters of air every day. And what do we breathe? Well, good question. Supposedly or supposed to be oxygen, but along with that, a whole lot of pollutants that are adding into the atmosphere every day, thanks to you and me, vehicular smoke, very fine particles from construction all around us. And the list just includes industries and a whole lot more. So I'm not going to get into that, but we've actually reached a point where we need to worry about what we are breathing, because all those particles go into our system and are creating havoc. When I mean havoc, I mean just not breathing problems. It's just not a sneeze. It's just not a constant cold. It's possibly heart attacks and even strokes. That's why we need to care. Now, every Indian city is facing this problem. Now, where there is particulate matter, it's far more than permissible levels. And how do we fix this problem? So we're looking at solutions in our series, Philips NDTV Breathe Clean.
Our air is laced with poison. "141 cities in India have particulate matter 6 times more than the permissible limit. Poor air quality causes premature deaths due to respiratory disorders. 1.3 million people in India die because of indoor air pollution every year. 80% of these deaths can be avoided. It is time for us to be the change. It is time to breathe clean.
I'm Um-e-Kulsoom, and joining me on the show is a very eminent panel. People who actually are trying to raise awareness about this massive problem, people who are trying to provide solutions, and people who have their personal experiences, people who are trying to tell the government to wake up, people who are trying to tell you and me that we are both responsible and we can actually fix this problem. So joining us on the show, Mr. Kamal Meattle right here, environmental activist, and someone who has a very personal experience and who's come up with a very innovative solution of trying to fix polluted air. There's Anumita Roy Chowdhury, the Executive Director from the Centre for Science and Environment. We have Dr. Vivek Nangia, the leading pulmonologist from Fortis Hospital, and we have Jayadhar Gupta, the founder of Walk Masks. Also joining us from the US, Dr. Joshua Apte, who has done some extensive research on air pollution levels in India. Anumita, let me begin with you. With all the research that you have done, why are we talking about air pollution now? Why haven't we been talking about it at the same level or at the seriousness we should have done maybe 10 years back?
You know, I will answer that question a little differently. It's that what you see today is a much higher level of awareness and, more important, an international glare on the problem. Somewhere along the line, the problem has been globalized and there's a lot of international attention, there's a lot of buzz around it. If you look back 15 years ago, what has happened in Delhi and what we call the first phase of action to clean up the air of Delhi, when we shifted out polluting industry, we shut down power plants, we introduced CNG program, that happened because there was public anger in this city. The solutions that are needed for the problem today need public support and public awareness.
Dr. Nangia, let me come to you. So we're talking about fine particles here that people, we don't see the black smoke, but you do see a lot of people coming in with related problems, various kinds of problems, and it's just not a sneeze, it's just not a cough.
Sure. So basically, you know, what we're noticing now is that, of course, there's this long list of diseases that can actually be attributed to this environmental pollution. The common diseases are asthma, chronic obstructive pulmonary diseases, which is called the COPD, chronic bronchitis, emphysema, then lung cancers, respiratory tract infections. They've all gone up significantly.
Well, I became allergic to Delhi's air in mid-90s, and the air quality was horrendous at that time. And I had a choice of leaving Delhi, and I started thinking, where should I go? And that was the discussion in our family. And at the end, I said, well, let me try and fix it if I can. And that's when the story began. And I was on the board of IIT Delhi, and I went there in one of the board meetings wearing a mask, and I said, you need to help me. I've not charged you a fee for attending meetings. Now it's payback time. You've got to do something for me. So all the heads came, and we started doing library research and found that NASA was doing some work to put people on the moon and space stations and grow their own oxygen. So I started thinking as to what the solution could be. Why did Lord Buddha sit under the Bodh tree and not under a neem tree? Why is there a tulsi plant in most Indian homes? Let's start with that. And in research, you're lucky or unlucky. As far as I'm concerned, we were lucky, and we found 3 plants. One to convert CO2 into oxygen effectively during the day in sunlight. One at night, call it the bedroom plant. Another plant which removes VOCs like formaldehyde, benzene, trichloroethylene, and a little bit of toluene also.
Right.
So we got these 3 plants, and we were very happy. So now we found solutions with mechanical filtration plus the plants, and at the same time reduce energy. So most people think it's a very expensive proposition, but we actually save money.
So we also have Dr. Joshua Apte, who's joining us from the US. Dr. Apte, you've been hearing this discussion, and you've been out on Delhi streets. The one thing good is this is a homogeneous problem. Rich, poor, young, old, everyone's facing it. Politicians, no politicians, all of us are facing it. Do you believe that our government is doing enough about it?
Well, if you look at the levels of PM 2.5 in Delhi today, those are the fine particles we need to care about for health. The concentrations on average in Delhi over the year are about 150 micrograms per cubic meter, or about 15 times higher than what the World Health Organization says is a safe limit. And what this means is that this is going to be a very long-term project to improve air quality in Delhi. The important thing is to make progress on as many fronts as possible.
You know, we spoke about awareness, and we spoke about the strides. So I'm one of those reactive Indians who got caught unawares. I was training for a half marathon and running in the morning, and you know, feeling great. You know, you're running, toxins are coming out, you're at the peak of your health, and suddenly I was smacked by, you know, whatever it was in the air, and my lung function dipped by about 60%. And I spent about 10 to 11 months chasing medicine, chasing science to find a solution, to find out what was wrong with me. And then I came across, you know, an expat wearing a pollution mask. And, you know, I was so tired of nebulizations and antibiotics and anti-allergies that I was willing to try anything.
Right.
And I adopted this mask, and it was amazing. It was like magic. 3 to 4 weeks, and I was completely clear, and you know, went from feeling 70 years old to feeling my age all over again. I think I'm just really pleased at the decibel levels. I'm pleased at the levels of awareness that we've reached. I think there's still a long ways to go, though.
Okay, so I'll take it on that all of you say that the level of awareness has gone up. All of us, we're talking about people here, do believe that there is a problem and that needs to be fixed. How are we going to fix it at a macro level, and how are we trying to make changes at a micro level? We'll discuss that right after this break. Welcome back. You're watching Philips NDTV Breathe Clean, our special campaign focusing on hoping to get solutions on cleaning up the mess that we've created. The air that we breathe is not entirely just clean air. It's full of pollutants, and it's causing health problems, major health problems that need to be fixed. And on our panel are eminent people who have solutions to the problem. Let me get Dr. Joshua Apte there. You've been doing research here in India. You've been interestingly moving around in an auto and try to record the pollution levels. But if we look at it in terms of, it's not India's problem alone. Almost every country in the world has been looking at it. If we look at developed countries especially. But if you were to draw parallels, what can India learn and quickly try and fix this problem?
Many countries have had to deal with air quality problems. And typically, the good news is when you start, there's lots of things you can do that are relatively inexpensive. Dealing with waste burning, dealing with the old high-emitting vehicles, putting in place modern emission standards, and so on. So there's lots of places to start.
But it's not that easy.
It's not. And what I really would like to point out is that there's a lot to learn from the world outside. Now, even though we are saying that the US and UK and Europe have been able to fix their problem to a great extent, but understand the character of the problem keeps changing, and that's a lesson for us. Even today in the US, more than 2 lakh people die prematurely because of air pollution related diseases, right? But there the pollutants of concerns are changing, and very recently the UK was taken to the court, to the European Court of Justice, for violating their air pollution standards. So it's not easy anywhere around the world, and that actually comes out with the global burden of disease estimates that shows that air pollution remains amongst the top 10 killer globally. In India, it is the 5th largest killer. Now, if in this country every year more than 6 lakh people are dying prematurely because of air pollution related diseases, now if any other cause was responsible for this many deaths, it would have been a state of political emergency.
Mr. Meattle, just ahead of the show, you were saying that there is no will. Would you believe it's just political will, or do you believe that our government succumbs to lobbies of the automobile industry is just growing by the day? We have how many? 1,400 vehicles getting added, cars that are getting added to Delhi's roads every day.
I think having more cars is not the issue, because cities like Berlin and London and Los Angeles and other places also have lots of cars. I think the issues need to be understood as to what the serious problem is. We need to fix NOx, we need to fix the PM 2.5s. Both are fixable, but if we understand that ozone and a combination of ozone, a cocktail of ozone and PM 2.5 is the problem, we need to fix these two issues in Delhi.
Dr. Nangia, is there some way the health ministry and the environment ministry can come together, our doctors like you, our experts from the field, giving them the idea that we have to work together on this, and there has to be something done?
There's enough studies in the world globally which have shown that every time there was an increase in the level of the pollutants in the air, there was a significant increase in the number of hospitalizations related to COPD, asthma and heart diseases. It has been labeled as the most common environmental factor which is contributing to poor health.
Right. Are you worried about the state, would you call it a state of emergency in that sense?
Well, if not emergency, but certainly something where we need to take some action quickly now, because there is a definite rise in the number of kids who are coming to us with asthma. You know, the problems start right from the womb, I would say.
Which is really sad, right? You feel really sad for children. Jay, you have 2 children, and do they walk around with masks? Personally, when I see people with masks in New York subway or something, like it seems strange, but do they wear it to school all the time? Do they wear it outside?
They wear it to school all the time, and it's interesting. They were reprimanded the first few days when they put the mask on and went to school. It was treated like a fashion accessory. And then I had to go and meet with the faculty and explain to them why they were wearing the mask, and then, you know, the pressure died down.
So I'm going to take closing comments from all of you. Dr. Joshua Apte, let me come to you. So do you believe the level of awareness in India among the masses is at a level that's commendable?
I think the change is amazing. I've been coming to India, to Delhi, for 10 years, and the amount of conversation this year surpasses all the conversation I've had in the past 5 or 6 years about air pollution. So this is the really great news, is how much people are talking about it. The fact that all of us are in the room today talking about this right now, that's the good news.
So let me come to you, Jay. What do you say? That quick fix solutions are always available, but we are trying to have a solution that is homogeneous and it's not just accessible to the rich. It's for everyone.
Look, it's a whole cocktail of solutions. There's no one quick fix. The one quick fix is control your micro environment, and that's not really a solution. In terms of awareness, you know, what I was referring to is, I think urban India is largely aware of this problem. I don't think the masses are aware of this problem. So we have to get to the masses. My thing is, you got to monitor, you got to raise awareness, and that's the only way to get momentum.
Right. Dr. Nangia, what do you say?
See, as far as the outdoor pollution problem is concerned, medically there's hardly any solution to it, except the only advice we can give our patients is that don't move out on the days when the pollution levels are high. Look at the AQI every day and decide whether you can move out or not. If at all you have to move out, then probably wear a mask. The other thing one can recommend is that, avoid too many vehicles on the roads. Have carpools, which will be an easy solution to it. Have more of plants around you, and of course the green plants and the indoor plants, of course, would be a very good idea.
Right.
And if at all still there is a problem, then always keep your inhalers and your nasal sprays handy so that you can take treatment immediately. There are these SOS reliever inhalers which can be used instantly when you have a problem. So this is about the outdoor ones.
Right.
For indoor, there are still some very simple solutions that can be carried out. First of all, would be keep the house very well ventilated. There should be large windows and large doors through which there is cross ventilation happening all the time. You should avoid heavy furnishings, heavy carpets, heavy curtains and all in the house, because they are the ones which entrap a lot of dust.
Anupita, because you work closely with policymakers, or at least you're putting out material that they should be using, what is it that you're trying to convince them at this point?
So today, when I look back, after doing all those wonderful things that Delhi had done at some point of time, the last few years had only been about adding just few buses and the metro. And nothing else has happened in Delhi. So what we're seeing is that the pollution is overwhelming the pace of our ability to take action. So don't look at Beijing today only to look at their air quality. Look at the scale and the depth of the action. That you are scaling up your public transport enormously. You shut down your power plants, relocate industry. Look at the stringency of the action. Now we have to prepare ourselves for that.
Mr. Meattle, that it's too complex a problem. Every complex problem has a solution. You came up with one in the 90s.
Well, I think there are simple solutions. Given the fact that the air quality of Delhi or Delhi NCR is going to be polluted for the next few years, till such time all these solutions come into effect, I think there are simple solutions. For example, if you gargle twice a day or thrice a day with salt water, it helps. You drink a lot of water, keep your nostrils moist, and perhaps put some Vaseline or some oil or whatever, edible oil, whichever oil you use, in your nose. Keep it moist, not dry. It helps. Then, as far as indoors is concerned, fill your homes with money plant, which grows in a glass of water. You can wash it. Keep hundreds of them inside, so they also reduce pollution indoors. And of course, like what we have done, a simple solution. We have 1,200 plants in 50,000 square feet, which has worked. So you can have solutions of that kind.
It's a complex problem, but it's not something that can't be fixed. At the end of it, we've been to the moon and back, and we're still talking about, not fixing the air we breathe. In fact, it's interesting, but I have to say this. When I was a little child, my grandmother used to say that there will be a time when you'll pay for the air we breathe. I didn't quite understand it but we're actually living in such a time. But it's pretty scary to know that air pollution, the air we breathe, can be linked to heart attacks and even strokes. So we've got to understand our resources here are limited, and we ought to know and respect how to utilize it. So on this series, we're going to continue looking at these issues and how to fix them at the macro level and micro level. Of course, it's got to do with laws and how they're going to be implemented, and it's got to do with you and me actually being part of the solution. Thank you very much for joining us.